Great, thanks, Sarah. So what we showed you there was Orion's clinical portal, which had a results viewer, a clinical document viewer. That was the first piece. A little bit of physician order entry, the disease management at the end, as well as the electronic discharge summaries. So back to this picture, which is, again, at the bottom layer, the operational systems that would be in hospitals, regional health organizations, provincial boards, those kinds of things. The repository layer, in this particular province, probably up to 10 repositories they're looking at. And of course, that'll differ by which jurisdiction you're in. And then at the top, an electronic health services layer that includes a number of different applications. As we indicated, the key, we feel, is this layer here, where you need data transparency, data integration, and interoperability. And certainly from the solution, the central station solution, that is the Oracle product. And at the electronic health record layer, it's the Orion set of applications and products. I want to just talk a couple of minutes, and I realize the left of the screen is cut off with this one, but just wanted to talk just a couple of seconds on the value proposition before we open it up for even the value proposition got cut off. That's fine. So we're looking at the value proposition from three perspectives: clinical, technical, and organizational. So from a clinical perspective, improvement in patient outcomes, certainly around that diabetes disease management. There's been documented studies by independent firms around the return on investment on that. Better use of clinician time, and I think you'd get a sense of some of the workflow benefits that would be derived. And also that these solutions fit within existing clinical workflows. These are not trying to layer new processes on people. From a technical perspective, again, it's open, it's adaptive. You know exactly what the data is in that repository. It's published. The APIs, which allow applications to get into it, are published. Some of the components are reusable. So those results viewers can be reused for multiple kinds of results. You're not buying new applications all the time. It's based on standards-based, and from our perspective at least, reduces the reliance on proprietary solutions. As somebody says, it's the icing on the cake. It fits over all of those existing legacy systems. You don't have to replace them all. You can put this in and still leverage all your legacy investment and keep changing your legacy investment over time. So from an organizational perspective, you can implement it in stages. It's portable across multiple geographies, within an organization, within a region, across a province. The total cost of ownership here, compared to going to much more proprietary solution, is reduced significantly. Without giving you the numbers, believe me, it is incredibly affordable. Some of these applications, there's demonstrable ROI, as I indicated, and certainly for the Central Station Consortium and the kind of proposal that we put forward in Alberta, there were significant partnership opportunities that we had with clients, and we'll continue to do that as we roll Central Station out across Canada. So I'm going to stop there and open it up for some discussion.
Maybe before we start the discussion, if we could just have